Hello, I'm here with, I'm here in Boswell. I guess they're having a big town hall meeting on the fate of Martella's pharmacy and how they've been squeezed out by Express Scripts. We even have billionaire Mark Cuban here, remote.
Good afternoon. Welcome to our My Pharmacy, My Choice Town Hall. My name is Monique Whitney. I am the executive director of a group called Pharmacists, United for Truth and Transparency. We were founded 15 years ago. We're a nonprofit, and we were founded by pharmacy owners just like Miss Jackie here to my left. I'm delighted to be here with you today. I and one of my board members, Brandy Chain, many of you have probably met her by now. She's a very distinct Texas drawl. We came here today to be with you and to have what is really going to be a conversation. So just to set your expectations, we are here, I will introduce my esteemed panel. We are here to talk about what has been happening with our pharmacy access, especially in rural communities. We're here to talk about solutions. We're here to answer questions, but it's a conversation first and foremost. And then of course, I'm so super excited that we have one of your own here joining us, and that is Mr. Mark Cuban, and he is on screen, and we'll unmute him in just a minute. But yay, Mark! Yay, Mark! And I will just say, having spent about 24 hours in this community and having met all of you, I see why Mark is such a great guy. This is a man with a huge heart, with a huge commitment to transforming something that up to this point the so-called experts have told us is not transformable. So together, all of us, we're going to do that. So I will start here with introductions, and what I'd like to do is ask each of, I was going to introduce the panelists, but I'm actually going to give them a chance to stretch their vocal cords. If you would each just say your name and the organization that you're from, we'll have a chance for everyone to get to know what you do as we have this conversation.
Well, I guess I'm first. So my name is Jackie Martella. I'm the owner of Martella Pharmacy. I've been fortunate to be in the pharmacy business since all my life. The year I was born was the day my dad started Martella Pharmacy in Johnstown, PA. Thank you.
I'm Dr. Zane Gates. I'm the co-founder of People One Health and presently co-founder of Gloria Gates Care.
And I'm Pam Tokar-Ickies. I'm Somerset County Commissioner and here representing all of the commissioners in both Somerset and Cambria counties this evening.
Our virtual guest.
I'm Mark Cuban. I'm co-founder of costplusdrugs.com, and I'm here to get rid of all the jagoffs messing with independent pharmacies like Martella.
Awesome. All right. So what we're going to do is I'd like to start with you, Jackie, and if you would briefly just take us back to May of last year and what actually happened when you found out about Martella's being cut from Express Scripts network.
Well, I opened the mail the first day and I received a letter saying that I was terminated from their health plan, and that was May of 2025. In the letter, it said there were two areas of the reasons they were terminating our pharmacies. And one was credentialing or re-credentialing, and the second was a compliance, that I did not notify them in 10 days of something that I don't even know what that something is. But anyway, so it ended up that I was terminated, so immediately called my attorneys and wrote a letter, 7-page letter with 49 pages of documentation, sent it to Express Script. That's how this journey began, and I thought there was a meet and confer period, and it was a good faith in their notice that I received. So I thought that it was just an error somewhere. I checked the box wrong instead of saying yes or no. You know, there's always this gray area. So I thought it was something that could have easily resolved, and you know, you negotiate and it gets fixed. Unbeknownst to me, that's not how the system works. So I ended up receiving notification, and I reached out to anybody I could talk to, my county commissioners, my state representatives, councilmen, congressmen, anybody that would listen to my story. And pretty much everybody, as I started my story and my journey, somebody would tell me, you need this attorney, you need to talk to this person. I went wherever they told me to go. So that's how the termination started. Then I find out that there is no negotiating when you're dealing with a company that's a pharmacy benefit manager that's worth billions of dollars. I'm just a little pea, and we're just a small community that they really don't seem to care about. So that is how the story started. And then I hired attorneys. I had one attorney, and somebody told me I needed a specialist, so I hired a second attorney, and that specializes in pharmacy benefit managers. I went down that route for about till probably November, and I just felt like it was a letter writing campaign, and all I did was spend money. My poor husband Bob had to live with me because I wasn't sleeping. Every day he wakes up, he hears PBMs. At night I come home, it's about PBMs. Like it's the same thing. So fast forward to oh, and the other thing, I have to mention this is kind of odd, but when I initially started this story, that I would hear when I went to my state representatives and different people, they basically said, oh, we received this phone call. Don't talk to her, that there's something else going on that she's not like disclosing. Now, I'm in good standing with the State Board of Pharmacy, with all my pharmacies, the Drug Enforcement Agency. I have nothing to hide to anybody, and I always feel like the truth prevails. If you're truthful and you're honest, your story will tell itself. Okay, so that's kind of the motto I live by. And so fast forward, we're in November, and I started just reaching out, and I went face to face. I met with from November till probably January, February. I met Attorney General David Sunday face to face. I was with Congressman Joyce in Washington D.C. I was with Senator Ward. I've been everywhere and anywhere, and I'm not a political person. I'm forced to become a political person, not by choice, but because.
In fact, let me just ask: how many people here would consider yourself a political person? If you're a political person, raise your hand. Okay, yeah, right. How many people are not a political person? How many people would rather do literally anything than think about anything having to do with politics? Yeah, us too. Sorry.
Anyway, no, that's okay. And give me the hook if I'm talking too much.
Well,
but anyway.
Yeah, well, no, I don't want to give you the hook, but in the midst of all this too, like you're dealing with this, right? So for the folks that are out there, how many of you had any idea that this was going on, what she was just talking about? And for those of you, show of hands, who was directly affected, who may have lost access or knows someone who did? Yeah, thank you. What do you think it was like? I mean, you were talking to your patients about this. What was the impact on them?
Well, we were trying to educate people as we were learning what was going on. And the frustrating part is when I went to Harrisburg and I met with the people in these political offices, they basically said they've heard no complaints from anybody. And last year when this first happened, our pharmacists, we didn't really know what was going on. We just get this termination. So we were telling people, turn your health card over, there's an 800 number, call your health plan. Tell your health plan, go to them. So, and that's pretty much what we did. And people wrote letters, they said they called the congressman, they called their state rep. And when I asked, I went to a state rep's office one day, drove to his office, just because I just wanted to tell my story. I gave my name, and he says, we know, his office staff said, I know why you're here, and they said, we're getting all kinds of complaints and phone calls. I said, what are you doing with it? Well, we're supporting you. We support PBM reform. That was it. Like, they can't help me. So,
Yeah, so that, just so everybody knows, Jackie's story, while it's unique in some of its specific details, it's actually not a unique story. There are pharmacies all over this country, in major cities, in small communities that deal with in some form or fashion with a PBM, a large vertically integrated PBM, meaning it's actually owned by a health insurer, and they end up getting the runaround, and then for reasons that are mysterious to us at my organization, even at the state level, you'll have a state official, perhaps even a highly placed one, who thinks that they have no control over this. They've forgotten somehow that the state is the customer and that they should have some say in that. So that we were attracted here for this story because on the one hand it's terrible, it's really terrible to have to work that hard when really, what Jackie I think wants to do is just be a pharmacist and take care of your community.
that is correct. I tell the politician, I'm a pharmacist, not a politician.
Yeah, so I think this would be a great, Pam, I think this would be a great time to bring you in and ask about what happened here. You're a fixture of this community, and you've seen the impact on this one. Well, I'm just curious, in your experience, what happens to a community when they lose its pharmacy? What's the impact on families? Who has something they'd like to share? I see a gentleman way in the back.
Hi, my name's Mark Pascarella. I am the chair of a group in Cambria County called the Greater Johnstown Regional Partnership. We have about 40 members of businesses, and quite honestly, most of them are either clients of UPMC or Highmark. Just wanted to tell you a little story and then tell you another story. But yesterday at about 5 o'clock, I got an email from the secretary, Arcouche from DHS, and she invited me to have a Zoom with her so I could learn about rural health care and have that discussion. But honestly, I think it would be helpful for somebody from Harrisburg to come into Somerset County Commissioner and learn about rural health care.
Thank you.
Get out of the office. I think it would do her a lot of good to know about what's going on. So let me tell you, I had a chance to talk to a board member at Highmark and a board member from UPMC. And the message was the same: in Express Scripts we trust. We have a contract. They're running our pharmacy program. So I did ask one of the folks, I said, well, have you looked at all the lawsuits that Express Scripts is involved in? And this was the answer. It was quite interesting. This person said, Mark, you don't get it. It's a shit show out there. It's a shit show. Everybody is being sued.
Yeah.
But Express Scripts, you really need to look at their legal rap sheet, okay? They settled with the FTC on insulin pricing. They're being sued by the AG of West Virginia for creating the opioid epidemic that went back to 2018 because they had very little controls over stuff going out. And they were accused by a Chicago union. There actually is a RICO lawsuit on basically them taking money and putting it in Europe on the Chicago Plumbers Union's plant. So look at what Express Scripts is doing and then ask, why does everybody trust them so much? I don't get it. Why does everybody trust Express Scripts? that's a question you need to ask, but you need to first see all the lawsuits that they've been involved in. Okay, thank you.
Thank you.
One of the things I don't think has been discussed adequately is the loss of jobs in the community. That could require a whole nother meeting. So I just wanted to bring that up.
Thank you. Appreciate it. Yeah, so thank you very much. It looks like we have.
Hi everyone, my name is Kathy Hauser, and I've raised a family in the community along with being in the pharmaceutical industry for many years. And I have seen firsthand how Martellas and Jackie and the Martellas have supported the community and me professionally and personally. So my ask is, if when they do ask about partnering up, you hear them loud and clear. And I'd like to hear from each and every one of you exactly how can we support you. There's power in numbers. I appreciate the grit, the determination, the resilience that you all have, but what can we do to help you?
Jackie, you want to start?
Well, we have our website, and basically by going to the website or telling your story, those stories will be documented. Where last year, those stories just went by the wayside. And so what we're hoping is that we can take our stories, so I can go back to the governor and Secretary Kush and Sally Kozak, Lindsay Malden, all the people that I spoke with and said they were hearing from nobody, that I can show them people are talking and they want to be heard.
Dr. Gates?
I think you support the people in government that support you. I think that's the message. That's the only message that elected officials understand, unfortunately. And I think that's the best way to really support the people that support the community and understand this healthcare problem.
Thank you.
I think my best suggestion to offer right now how you could help would be to call your state legislators. There is a bill that has been introduced that could resolve this in November. Correct me if I'm wrong, Jackie. It's Frank Burns' bill,
Yes.
right? And that House bill is what number again? 2431. 2431? HB 2431. And that will require that Jackie would have an opportunity to actually be back into the system, because it would be against the law of Pennsylvania, if that bill can be passed, for a PBM to bump someone out without the right to do that. So pick up the phone, call your state legislators, ask them to vote. It's in the House right now. I don't know if it has been scheduled for a vote. It needs to be scheduled for a vote. It needs to work its way through the state legislature before November, and this can be resolved immediately. That's immediate, before the end of this year. Because I'm afraid if we don't do something now, we're gonna lose more independent pharmacies. I hope it's not Jackie. I hope it isn't anybody else, because we can't afford to lose any more in rural Pennsylvania. But House Bill 2431.
Any pharmacy that is in good standing with DEA, with the Pennsylvania Pharmacy Board, and also with Medicaid, which the Martellas check every box, should be able to fill a prescription for people on Medicaid. We'll start there, because unfortunately the communities around this area have a disproportionate share of Medicaid, and we want to start there for people that have don't necessarily have the means.
So, yeah, so it's 2431. When your legislators are coming around in the fall asking you for their vote, tell them you want your access.
Can I just say one thing also? The governor can pick up the phone. He has the power. Like, I've been there. I've talked to people within the government. The governor has the power to call the president of UPMC and Highmark And why can't we meet? Like I have, you know, I've sat here and said that I've tried to go through the routes and, well, I would just like, if I could meet with them and share them the documents, my paperwork, if I just get a fair chance to tell my story.
He's a coward.
Yes.
That's why we're in this situation.
Thank you, Jackie. So, and then I guess my comments would be, it's important to remember that you are the one with the vote, you are the customer, you are the patient. We have been systematically led to believe that we don't have any power because it's all way too big. It's just, you know, it's too big, they're too big to fail, they're too big to jail, they're too big to care, all of that. But that is not true. I've seen state to state, when groups of people get together, even if it's a small group of people, when they take committed action, they really can make things happen. They can get laws passed, they can get laws undone, they can get a pharmacy back in network simply by demanding their right to have their choice of pharmacy. And this group looks to me like you could get that done pretty readily. So just thank you all very much. So I think, as we look at this, we're in our last few minutes here. So what I would like to do is let's each of us take a moment, if we will, and let's just, in our final thoughts here. So we've talked about a lot. There's so much inside of what we've been talking about. We could host a town hall every single day for the next month and talk about, where does drug pricing come from? What was that overseas thing that someone just mentioned? Like, there's so much here. But in this journey, we've already covered quite a bit. Starting, Pam, and then we'll move this direction. What are your thoughts about, based on the conversation today, what do you see as the future of healthcare, particularly rural healthcare, there's a rural healthcare transformation project, which we didn't have time to go into today, but just what are your thoughts about where we can go from here? What the future of rural healthcare is?
Wow, that's a lot.
That's a lot, and you get 2 minutes. No, I'm just kidding.
Yeah, 2 minutes. Well, my true thought is, in closing, that this is just wrong. This is not the way the system should work. It's not the way we should allow the system to continue to work. And you have really your voice. And if that doesn't work, you do have your vote. Your voice and your vote. And that's all you have.
Yeah, and it's enough.
Yeah. And essentially, at the heart of this is taking away your choice as a consumer, your choice of your pharmacist, your choice of your pharmacy. And that really stands counter to everything that, you know, we stand for. And so I think you have to make that message very clear. If our state and federal legislators aren't connecting the dots, those stories, those calls, those communications, you need to help them connect the dots. You need to make this very clear. And we should all be asking the governor, what can he do? I'll be the first one to do it. I'll be glad to make that call. We've already tried to have that happen, but in the wake of the town hall meeting, I think it's an even more compelling argument to make. And I think that, you know, that's all you can ask. You can ask to be heard, and they should want to listen.
You know, especially access for children to health care. Just what are your thoughts on this?
Well, first of all, I think it's important to put this in context as to what this issue, which is a national issue, which I was one of the politicians that Jackie contacted to talk about this. And I have to admit, I didn't know a lot about it. But to take a 10,000-foot view of this issue, and then to realize when you superimpose it over the Cambria and Somerset areas, we have really been hit hard. And I see with the show of hands today, that's very evident. But just to give you a sense, we've lost 7 community pharmacies since 2020. And in case you didn't realize it, in Somerset County, the Medicine Shop in 2020, Yock Valley and Confluence in 2024, Main Line in Davidsville in 2024, UPMC's outpatient pharmacy in Somerset, Giant Eagle on Glades Pike in Somerset, Rite Aid in Windber, 2025, and Martella's, unfortunately, because Jackie had to, in Central City in 2026. And for my Cambria County colleagues here tonight, by my count, I think you're at about 19 closures in Cambria County. And that's between the independents and the bankruptcy of the Rite Aid chain. So here we are tonight, and I can tell you that this is a big impact. When a pharmacy closes, and I hope that Jackie doesn't have to do that in any of the other pharmacies that serve our small rural communities, it really does give your community a very big challenge, because these are small businesses. If you stop and you think about it, the role that pharmacies play, especially in a rural community, is really kind of like the modern day general store. Think about it. Yep. You go to your pharmacy, you go there for your prescriptions first and foremost, but you also see your friends and your neighbors. You know, you can do a lot of other business there. You pick up bread and milk, you play the lottery, you know, you name it. Chances are Jackie offers it in one of her stores. That's why there's such a turnout here tonight, because you know the importance of this business on Main Street here in Boswell. And, you know, I was thinking about, you know, my experience. Probably one of my earliest childhood memories is my mom taking me in Somerset. We lived in Somerset at the time. We'd walk up to Sun Drug. Does anybody remember Sun Drug in Somerset? Okay. I think she was really just trying to get me to take a nap in the afternoon. But, you know, we would walk up there a couple times a month, maybe once a week, and we'd go maybe sit at the soda fountain, you know, have lunch. I'd get to go to the toy section. My mom would pick up some necessities, maybe buy a magazine, and we'd go home. And that really is what a lot of people, you know, remember. A lot of sitcoms think about it. The drugstore is always the center of everything, because it's really the intersection, especially in many small communities. It's our local community center. And it's very ironic to me, because weird things happen, timing. I found a study that I didn't realize I had received about a year ago, and it was done, I just found it last week in preparing for this. And it was done by the Center for American Entrepreneurship. And they were looking at the state of small business in Pennsylvania. And you know, at a time when Americans really can't agree on too much, they agreed on one thing. Small businesses are the foundation of our communities, particularly in rural Pennsylvania. And here's what that study said. It said that if you have a small business in your community, they really give back to your quality of life. The business owners work there, they live there, their kids go to school in your community. Your business owners probably support other businesses and use those as suppliers for their business. They care about where they do business. And so when you lose that storefront, oftentimes that storefront never comes back. I would say, and I have family that lives in Boswell. My grandpa used to be the police chief here years and years ago. Boswell has seen a lot of changes over the years. After the decline of coal and steel, you know, a lot of things changed. But something else changed. And I don't mean any disrespect to the businesses on Main Street, literally Main Street on Boswell, but I would say, if you drive into Boswell, this is the new Main Street of Boswell. If you come in Boswell this way, a lot is happening here, because this is a hub. This is the network of your community. So think about that. It's not only about prescriptions and access to health care, which is really the underpinnings of this whole thing. It's really about the heart of your community. Independent pharmacies, we've been hit hard. 19 in Cambria, 7 in Somerset. We don't want to see any more.
Thank you. I love that you said that, because, you know, small business pharmacy is a small business. It's also a health center, and I know in my work, I talk to pharmacy owners. I've met pharmacy owners who quite literally have driven in the direction of a hurricane to open up their pharmacy to be available, have stayed open when an entire town has been evacuated because wildfires are burning, and they're open because they're treating people for smoke inhalation. I've met pharmacy owners who are the triage center for their community. If someone is having, what do they call it, a cardiac event or something like that, you know, they're the ones that are there taking care of it. I think since we're talking about small business and business, I think it would be a great time to turn to the businessman on our panel, Mr. Mark Cuban. And Mark, I know you are no fan of PBMs. I would love if you would please share your story with us about how you came to discover the PBMs and what motivated you to be on the mission that you're on now.
I mean, I just paid attention. You know, when you look at what PBMs do, they try to hide everything. They're opaque. They're too big to care, and they try to take advantage of any pharmacy or patient they can. Martella's is a perfect example, but they're just one example. You know, not only do they cut pharmacies from the network, but ask Jamie what happens when they get reimbursed for brand medications. They get under reimbursed, less than their cost. I mean, every step of the way, they're getting taken advantage of. So the real question becomes, what can we do? You know, Jamie's done a lot of the right things, Put and Brandy have done a lot of great things. But I think what I learned a little bit late, and I think it's important here, you have to realize that PBMs are part of vertically integrated companies. They're part of these huge conglomerates. In the case of Express Scripts, they're owned by Cigna. And so I would ask all of you, or your companies, or if you work for this state, are you doing business with Cigna? Because it's not just about their PBM, Express Scripts. Cigna is the parent company that defines how Express Scripts does business. And so if you're working with Cigna, please don't. Find somebody else, find another insurance company. Let them know that Martella's was so important to you that you're just not going to take it sitting down. If you work for the state, check to see what contracts you have with Cigna. Because I'm sure there's some, I'm sure they're big, and find out if you can have an impact on changing. Go to, Michael Humphreys, the insurance commissioner, and just tell them that this PBM, Express Scripts, which is owned by an insurance company that they're in charge of, is doing something that's hurting communities. Not just Boswell, but a lot across the state. So, I mean, we all can have an impact by literally just seeing who we are doing business with. So that's what I'd encourage everybody to do, you know, or you can take a term from Kevin O'Leary, Mr. Wonderful, and tell them these PBMs, we want to take them out beyond the barn and just shoot them, right? It's time to change things.
That's awesome. Well, if that wasn't, you know, perhaps illegal and would lead us all to capital murder charges, I think that would be a really excellent idea. Actually, Mark, but you didn't hear that from me. Mark and Dr. Gates have a common vision for affordable healthcare, medications, and I think Dr. Gates, in your case, also care an affordable cost. I know many in this part of the state work with you, and you work with Medicaid, with state Medicaid. I was curious if you could share with us why that is important. I think there are some people who maybe are not familiar with what you do, so maybe take a moment, if you would, to describe that, and then just why is this important? Why does this matter? Why should we be looking at this model?
Sure, because sadly, in the next 3 to 5 years, we're going to be in a healthcare crisis, and everybody should be running around with their hair on fire, because we're not, because there's lots and lots of people making a lot of money and giving us a false sense of comfort. What I've done is I've taken all the things that we commonly need in healthcare: primary care, radiology, MRIs, CAT scans, cardiology testing, psych integrated into primary care, physical therapies, and generic drugs, working with the local pharmacies without a PBM, and put them all together and made it one price. and integrated in with plans and worked with Medicaid and Medicare and small businesses, because insurance was never designed to do what we're asking it to do. Everybody's mad at the system and we're upset, but we as a communities and stuff got to change. You want to directly buy as much health care as you can and purchase it for one price. There should be no co-pays, no deductibles. They were designed for insurance to stop people from using things. The problem is the only lever that companies and government and anybody else has to control healthcare costs is just to take it away from people. Take it away from that waitress that's working 2 jobs to support her family. Taking it away from, the mailman. Taking it away from communities. In my model, you bundle all these things together. Now, you give back the control to the healthcare professionals. People understood how this all started. It started in the 30s with Kimball, who was a superintendent of a school in Texas. And he went to Baylor Hospital System and said, hey, I'm a superintendent of schools, I'm gonna do something for my teachers, so I'm gonna directly give you $3 a head, would you guys take it? And Baylor was like, hey, this was great. So then he turned around to the teachers and said, I have 3 plans. I have a white plan, I have a yellow plan, and I have a blue plan. And that's where Blue Cross. It was a direct relationship between the people, the employer, and the providers. Somehow it's gotten all messed up where there's all these middlemen that are unnecessary. Give it back to the healthcare professionals. There is nobody in an insurance building that's ever sat by somebody's bedside and told them, their loved ones, that they might not make it. Or, you need this medication. Or, I'm here to listen to you. So, in our model, there are no copays. There are no co-insurances. There's no prior authorizations. Do you think I really want to put people through stress tests and CAT scans? I get no benefit from it. I'm doing it because I want to improve their health. And as I said, in the future, the next 3 to 5 years are going to be some of the worst years. And it isn't nothing can stop it unless we do drastic movements like he's doing and like this direct care movement. There's something called DPC, direct primary care. I take it to one step because I don't think primary care is enough. I think you need all these other services to really reel in the cost and give the power back to the people.
I think that's really well said. Yes. Thank you. And I think it would be fair to say we feel that way about our pharmacies. So we'd just like to be able to go to the pharmacy that we'd like to go to. If mail order works for us, and sometimes it does. There's nothing wrong with that. But when you need the medication, when you need it now, you may not have 2 or 3 days to wait for that. So I think that what you're pointing to is really important, and the some people, you were talking about an impending crisis, some people can call it the healthcare bubble. I know for myself, every time I've ever spoken with a pharmacist or a legislator or people in my life, I'm always explaining it that the level of thinking that got us here is really the same level of thinking that got us in the 2008 financial crisis. It's not providers who are sitting here figuring out how to squeeze out the money. It's actuaries, it's data people, it's the folks that sat down and said, what we should do a collateralized debt obligation. How does that sound, right? And the next thing boom, the economy is imploded and here we are. Except it's our healthcare, which somehow makes it even worse. So, question, and I'm going to direct this back to you, Dr. Gates, and then I'd like Mark to also answer this as well. And that is, we hear all the time that really this is a contract issue. So every time your pharmacist has ever, tried to work this out, and she has, at some level, someone has said something to her like, well, this is a contract issue between private parties. And my question is, who's sitting at the table when these contracts are being made? Who's there? Who's not there? What's the deal with the contracts? What types of contracts are they? And I think you know this very well.
Yeah, there's definitely no clinicians. There's no patients. There's finance people. Our healthcare system has become a finance. Even insurance companies don't make money off of the difference between what they pay and what what they pay, what they receive, and what they pay out. They make their money like banks. They take all your premium and they invest it. And then when they start to lose money, they raise the rates so high that you have to switch. And you keep doing it year after year after year after year. So the wrong people are at the table, and it makes providers helpless. It makes pharmacists helpless. I'm a pharmacist as well. I sympathize because I know what not having her and her organization around these communities means. I mean, she sponsors one of the greatest baseball tournaments that ever lived. I mean, you guys laugh, but this is stuff that's really, really important, and what makes us work together, stay together, pray together. It makes us a community, and that's what's getting lost. Healthcare is not, we are very primitive in healthcare. Do you ever wonder why, we're talking about artificial intelligence and, rockets that go, and we're still using mustard gas, it's cyclophosphamide to treat cancer, is because when we come up with a good idea, it starts out expensive and always stays expensive. When Mark and the tech industry, their industry starts out, expensive, it becomes enormously cheap, and that's how it scales. So contracts, the wrong people are at the table. We have no say, we're helpless.
Mark, my follow-up to you is, as someone who clearly has expertise with contracts, how are these contracts structured? Why is it impossible for even, someone who's had businesses the size and scope and impact of yours, unable to get your data, unable to, break through these, is forced into arbitration, which is in its own way stacked against the very people who brought the complaint in the first place?
Well, I use cost plus drugs as an example. We want to carry every drug, but we can't. We don't have a lot of brands. And the reason we don't have a lot of brands is the big three PBMs have gone to the brand manufacturers and told them, if you deal with costplusdrugs.com, we will remove or diminish your positioning on our formulas. And if your drug isn't on the formulary, they could lose tens of millions, hundreds of millions, or billions of dollars, which of course they're gonna say, Mark, we love cost plus drugs, but we're not gonna cut off our nose to spite our face. They are so intent on control more than anything else that everything else goes by the wayside. This is a situation where the interests of patients, independent pharmacies, independent physicians, you name it, they're not aligned with the stock price of the big insurance companies that own the PBMs or vice versa.
Thank you. So, one of the things that has been a theme as we've been talking about this has been, speaking upward, speaking out. So I think, Jack, you mentioned that some of the organizations, some of the state entities you spoke with had said, well, we've not heard from anybody except maybe you, so maybe this isn't the problem that, you think it is, right? How many people here are familiar with PAMyPharmacyMyChoice.org website that we set up? Some people, okay, fantastic. So funny story about that. So we hear this all the time at Pharmacists United for Truth and Transparency, where patients do take the time to issue the complaint, and it's like it goes into a great complaint black hole, and for some reason the state agency doesn't get it, or say they don't get it, or who knows what happens to it. And so what we did, because we knew that this community had been issuing complaints, we were very well aware that, we set this website up to start tracking, but the one way we could, visits to the site and clicks through for people who were issuing complaints. And I thought you might be interested in the statistics as they were a little while ago. They've since increased, but as it turns out, more than 250 of you visited the site and clicked through to your state legislators. Really impressive. We had 120 of you click through to your federal legislators. There were 57 that went directly to the governor. By the way, the governor is copied on the state legislators. So really, the governor received, at the last count, and I think it's since greatly gone up, then 307 complaints. And then 83 clicked directly through the Department of Health Services. I think that's worth a round of applause for yourself for taking time to do that. That's phenomenal. And as I understand it, all of a sudden, Jackie started getting some interest back from some of the legislators. And I know Brandy and I will be in Washington, D.C. tomorrow, and we now have a meeting with one of your representatives to talk about that and to talk about the town hall. So I would just like to take a moment to thank you and applaud you for your effort. That, by the way, isn't all. So I also know that in one of the advertisements you ran, there was a tell us your story. People could fill that out and send that in, and you received how many? 300?
We received almost 400, but to tell my story, which is an interesting piece, when Monique initially came and talked to me about hosting a town hall, her team put together a QR code, and they said to have people go on, put this poster up, and you'll see the poster around, and there's a QR code. And I said, a lot of people in this area don't know what to do with QR code, and it's not saying anything against the people that live here. It's just we just don't know how to use one.
Yeah.
So I said, and through the help, my sister-in-law reached out to somebody to tell my story. So we adopted that and we put that in our advertising, and it's amazing the time people spent to tell their stories. It wasn't just, it was in the newspaper and it's just a small piece, but we received people that sat down and wrote letters, took the time to write the letter to explain how important the pharmacy, Martella's pharmacy community is, and that says something in itself. So it's not the number, but the stories are just incredible, and I thank you for reaching out and doing that.
Yeah, thank you. Thank you all. And unfortunately, it's time to put Pam on the spot to ask about so you're a champion for the community, and you have been for some time, and I know when you were hearing that not everyone was getting the complaints and the stories that people were trying to share, I know that was of concern to you as well. In your opinion, what do you think? What do you think causes that? What do you think it says about the system that the complaints don't always get through, or somehow they aren't maybe understood? Just what needs to be fixed here?
I'm not sure, because in local government, those complaints come to you directly. There's no dodging them. We're all here tonight. I'm sure before all of us leave, anybody who wants to talk about anything is going to feel comfortable enough to come right up and just talk to your local officials. When it gets higher than that, I don't know. I would assume that there is some type of count of people that they register through their receptionists or their frontline people. I just think people are failing to, there's a huge disconnect, because this is a big issue. And if people are calling and they are talking to their state and federal legislators and their state agencies, and those individuals are saying, we're not hearing from you, then the question is, why not? What is causing that disconnect? And I think they need to start connecting the dots. You can't be for small business and be for health access and not understand the dynamic of this problem. You can't be on both sides of this issue. I don't know anybody that supports monopolies, but what we're talking about is a monopoly, pure and simple.
Yeah,
it's a monopoly. And even the Federal Trade Commission did a study in 2024 where they talked about what Mark referred to earlier, the vertical integration, and their very own study that all of our federal legislators have access to, they should read it, says it gives vertical integration is not something that encourages small business. It encourages the corporation that's vertically integrated, and it actually drives drug prices higher. The reasons that PBMs came to be was to keep prices lower, correct me, Dr. Gates, if I'm incorrect. But it's doing the absolute opposite of that. And so there's a huge disconnect. And I think we all have to talk to our state legislators and say, look, each one of you can do something. Our federal legislators, each one of them can do something. State agencies, the governor, I don't care what side of the aisle you're on. And together, you can stop this. They may not be able to fix it individually, but if each one of them addresses it at their level, this will stop. Other states have done it. West Virginia has done it successfully. We need to look at other models, because in Pennsylvania, what we're doing is not working, and we are working against ourselves and what is better and best for our communities and for access to health care.
Thank you. We've talked a lot about what the circumstances are, what our situation is, that pharmacies like Jackie's come up against this all the time. The result is not always as successful as Jackie has been able to be, given the support she has in the community. And I know her strong commitment, her family, her dad, when he was alive, this has passed, her brothers. I've had a chance to talk to the whole family, and the commitment to this community is just really, really moving. But sometimes it just doesn't work out, and pharmacies end up closing. And I think it's important for us to talk about what happens when that happens. And this is going to be a grand opportunity for all of you to ask questions and to share your stories. But I'd like to start, Jackie, with you, and then Dr. Gates, and just and then I know at some point Mark is going to have to drop off of this. So I'm going to ask him for a closing comment. Mark, you just let us know when you have to go. So I think you were only with. Thank you, by the way, for being with us. We appreciate you so much. What is the impact? What is the very real cost when patients lose access to a pharmacy? Jackie, why don't we start with you?
Well, when patients lose access, that has to do with it's people they trust. Like, we know the patients, we know you. You know us, like you trust us, we trust you. So when you lose that, all of a sudden you lost the person that cares about you. And all of a sudden you're left to go to talk to somebody or try to maneuver a system that is complicated. So, I mean, it's difficult. And as a result, people don't take their medications. People end up in the emergency rooms. People sometimes give up because they just feel that they can't get help anywhere. So,
yeah. And Dr. Gates?
The outcomes of private independent physicians and independent pharmacies are better. People do better. Our natural history has been the community pharmacy. The big chain drugstore, and I've worked at them, and I can tell you it's very impersonal. It really is, and that's why I'm a physician, taking the pills from the big bottle and putting them in the little bottle. No connection. And that's what's great about independent pharmacies, especially hers and the independent pharmacies in our regions that I support. When they go away, you just don't lose a drugstore. You lose a central part of the community. People's children. You remember going to these pharmacies as a kid and growing up and watching the pharmacist get older, and then his kid coming in and taking over. I mean, that's the beauty of what is healthcare, right? Communities are healthcare, not corporations.
Yeah, thank you. And Mark, I know you are in danger of being loved to death by this community, but I know that, I mean, the stories I've heard you tell about cost plus drugs and forming it, and this was, I think, the perfect market-based solution. But if you could just say a little bit about, what motivated you to start cost plus drugs. How's it been? What insights have you seen? I mean, I just would love anything you would have to say about that.
Rather than talk about cost plus, as much as I'd like to get business for Cost Plus, I'd rather everybody take all their business to Jackie and myself. You don't have to do business with me. Do business with myself. That's far more important. But let me add to that. 92% of prescriptions are generics, and most generics are inexpensive. And right now, a bunch of you have plans that use Express Scripts as their PBM, and you think you can't use Martellas to go pick up your medications. If it's an expensive brand, I understand that. You want to keep your low copay, that's understandable. But for everything else, you should just go use Martellas. If it's a statin, and just tell me when you walk in the door, did you just say to Jackie, screw Express Script, get garbage, get jag off. And you know what? It might cost me an extra $3 to $5, but if you'll give me your cash price, I'm doing business with you. And I'll add this, and I got the chance to speak with Josh Shapiro when I was in Pittsburgh for an event a couple months ago. And we talked about healthcare and pharmacy, and there's a long list of things we discussed. And I know he's very in tune to independent pharmacies. We talked about that. But one of the things I asked for him that I'd asked for the commissioner and others to support, and that is for any cash pay, you can deduct it against your deductible with your plan. So that even if you are with Express Scripts, unfortunately, you can go to Martella's and say, look, I'm gonna buy this statin for $10 and I wanna turn the documentations to Express Scripts so that it counts against my deductible. So please push for that with any politicians you talk to, any representatives, senators, governors, whoever it may be, because that opens the door for you to go buy from Martell, take your invoice/claim, send it to Express Scripts, do the paperwork that says count this against my deductibles, and I want you to write at the bottom of that page, nah, 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 nah. Because as consumers, we can't stand up and do things. We do have choices. You don't have to work with Cigna. You can work with Martellas, even if your plan is with Express. And if you've got your plan with Express Scripts through your employer, you can tell your employer that the next time they negotiate to make sure any cash buys for anything, not just drugs, counts against your deductible. And if they continue to use Cigna/Express Scripts, you're gonna need a really big raise so you can go spend all your money at Martella's. Thanks so much. Thanks for everything you're doing. Jackie, keep on fighting. It will pay off. Thank you, guys.
I'll tell you what, one very lucky community to have Jackie and Pam and Dr. Gates and Mark Cuban. My gosh, it's like a blessed part of the country. Really wonderful. Okay, so we are, I was going to actually offer up an opportunity. Mark, I don't know how much time you have. A show of hands, like 1, 2, 3 minutes left before you have to go, or is he gone now? He is gone. Okay, well, I guess if anybody has questions for Mark Cuban, let me know, and we will get them to him. He's really good about answering those questions. So let me just look and see if there is anything. I do want to wrap this up with an important message, but what I think I'd like to do is let's have some of our community members here. So we had some people who were interested in sharing their story, and so I wanted to give those people an opportunity to say a few words, share their story with us, and then also for those of you who have questions, we will also please feel welcome to ask your questions. So I'm going to start by calling on the individuals who wanted to share their story, and then Thereafter, I'm going to go into the Q&A session, and if you would like to ask a question, we'll just raise your hand and we'll do that. So the first person that I would like to ask is Chrissy. Is Chrissy? There she is. Okay. So we'll have Chrissy come. There's the microphone. Go ahead.
Hi, everyone. My name is Chrissy Troxel. I've been a pharmacist at Boswell Prescription for 30 years. I know my customers. I know their families. I know generations of their families. I know the services they need. I know if they're at the register, by their voice, if they ask for something over the counter, I know if they can take it. And I'll tell them if they can't. I truly care about them. And I treat them like my family. Our entire staff does. My pharmacy partners, technicians, the girls out front, they are all our family. We're a family, and all of our customers are extended family. And we'll fight for them. We will. And we will be their advocate. We will be that person in between a specialist and a doctor if we need to clarify something. We will make sure that they are taken care of just like a family member would do that for them. This isn't going to happen at large chains. They're not going to be able to absorb, talking to Commissioner Ickies has said, how many pharmacies has closed? How many more customers can they take on? And we don't want to see our family leave, because we know we are the very, very best people to take care of them. So I am frightened. I'm frightened for my customers, my family at work. Continue to fight for us. Come and talk to us. Talk to anybody in the pharmacy. If we will work with you, we'll make it happen. We want you back in our store, and we don't want to lose you. So the door is always open. Come up to the counter. We will always be there to help. Thank you.
And then next is Janine. And yes, we did this on purpose, just so you know, too. We were looking end to end.
Good evening, everyone. My name is Janine McMillan. I'm the Executive Director at the Center for Population Health. We are an advocacy and collaborative organization focused on all things health and human services for Cambria and Somerset counties. I wanted to share a little bit about our work and what we've been seeing in the communities with regard to access, as well as sharing my own personal story as well, and how Martella's has just been a godsend for my family. So from an access perspective, as Dr. Gates said, we really see, so many challenges in our rural communities, whether it's oral health. Has anybody tried to find a dentist lately? Right? Primary care, huge issues with access, and our communities in Cambria and Somerset County have really been advocating and rallying around trying to meet those needs, but we know there are so many challenges with regard to that, again, from a rural care perspective. And just sharing some of the data, I apologize, I need my readers to read this. Sharing some of that rural healthcare data and some of those challenges that we see. 1 in 9 households in Somerset County in particular does not have access to a computing device. About 15% of the households in Somerset County, 1 in every 6.5 households, do not have an internet subscription. About 8% of the households, 1 in every 13 households, do not have a vehicle. Those issues compound that access crisis that we're seeing in our communities. And we know that having the pharmacy here in the community where folks can get that easy access and go and help to talk to somebody and meet those needs is so important. sharing my personal story, I have been the primary caregiver for an elderly aunt who was born with an intellectual disability for the past 20 years. I know Jackie knows the 8th Ward very well. She's lived in the 8th Ward, and she worked for the Cambria County Association for the Blind and Handicapped for 49 years, their longest employee. My aunt, up until a few years ago, was able to walk to work, walk to the association, and walk to Martella's to pick up her medication. And unfortunately, as her health has declined and her age, she was no longer able to do that. The other challenge being, with her intellectual disability, not recognizing some of the medications that she needed to take, not really sure which pills they were. Having not only the ability to have somebody deliver that medication to her, but the Medipack that was available to her as a Martella's customer was a godsend. And it allowed her to be able to stay in her home longer. I helped to provide that care coordination, but she was able to handle that medication on her own, and having that delivered was a godsend to me as well as a working professional. So I cannot say enough about the importance of your advocacy and sharing all of your own personal stories with the health and human services communities, as well as with our legislators and other folks who can really make an impact on this and ensure that Martella's is here for the long run. Thank you.
Thank you, Janine. Next we have Barb.
Hello, everyone. Nothing about us without us. That is the chant of the disability community. Recently, Governor Shapiro did an executive order to essentially say he supports the rights and dignity of the disability community. I have to question that a little bit. The sentiment is wonderful, obviously, but I don't feel like the disability community's voice is being heard in this matter. My friend Jessica is sitting here right now, and one of the complaints, or one of the things that Express Scripts is using as an argument is about the proximity to a pharmacy. My friend Jessica lives across the street from Walmart, right in Johnstown, in Richland Towers. And the infrastructure there, I don't know if any of you ever paid attention to that intersection. There is absolutely no infrastructure there for her to safely get across this street in her chair with her service animal that she needs. Crossing that road, her and her fiance do when they have to, but many times, Jackie has seen it, it's a very dangerous situation. I don't think Express Scripts, located in what, St. Louis, really understands the infrastructure issues we have here in rural Pennsylvania. They did not take into account the lack of access. They may say, hey, this town is, as the crow flies, 5 miles away. But to take the roads or to cross the street is not doable due to the lack of infrastructure. And to go off of what Janine just said, all those people do not drive and do not have access to many of these things that they need to be able to do that. I'm a professional disability rights advocate. I am also a disability studies professor. On top of that, I am the daughter of independent pharmacists. Pharmacies are the heartbeat of the community. The independent pharmacy that my dad ran was the heartbeat of the community. I know that someone here mentioned about pharmacies stepping up to the plate when there's natural disasters. In 1977, when the flood hit Johnstown, the flood destroyed my dad's drugstore, completely demolished it. And instead of him giving up as a new business owner, he chose to continue to serve his community. He opened up a trailer and had it guarded up at the high school, and continue to serve the community the medication they needed to keep living through this crisis. I doubt if this were to happen to us again, that Giant Eagle and Walmart would do the same thing. Maybe they will, I don't know, who am I to speculate? But if I were to take a guess, I mean, I couldn't even get a donation out of them when I was running for Miss Wheelchair Pennsylvania. I mean, I doubt that they'll do something to that extreme, right? But overall, I have to wonder about the government listening to the voices, not just of everyone here, but of those most impacted. And I can tell you, working closely with the disability community, many people are absolutely terrified to speak up on these matters in fear of losing their precious home and community-based services and their Medicaid that keeps them living and allowed to go out into the community every single day. And Jessica is just one of those people. And Jessica served as your Miss Wheelchair Pennsylvania 2021 as well. Okay, give her a round of applause. She represented our community with such dignity, passion. So with that, I just want everyone to know that I do essentially what everyone said, and perhaps someone here can kind of go into a little bit more about that proximity issue. I think there could be some clarity on that because I can't speak on the full, but I think one of you guys can. But thank you, everyone.
Thank you, Barb. And I will say from natural disaster experiences in other states that have had more than their fair share of hurricanes, Walmart never actually even one time opened up for the community, though the independents did. I'm not saying it was all Walmarts, but for sure you weren't off base on that. So.
I kind of figured.
Yeah. I mean, I can say that. We don't want anybody else on the panel to say that. Stephanie, hi, there you are. We didn't have a chance to meet beforehand, but I understand you also had something to share.
Hey everybody, I'm Stephanie. I'm Chrissy's partner. I work here at Boswell. I just wanted to take a minute to just talk about my perspective. It's a little bit different than Chrissy's. She's been here 30 years. I'm kind of the opposite. I've only been here a couple of years, but I'm kind of ashamed to say that my job prior to coming here was for a PBM. So I personally know what kind of service a PBM provides. I personally know that you're just a number. Working here, Jackie, my coworkers, we know all of you people in the community. We care about you people in the community. When you don't have your medication on a Friday, we're going to do our best to get it to you. A PBM, there's no way for that to happen. I've worked for big box retail. It's the same thing. Not that I was any different of a pharmacist then, but the restraints of my job because of the volume that we didn't allow me to be the pharmacist that I can be working for Jackie. She cares about me being able to talk to you, about me knowing your kids, about your lives. It's not just about the revenue you bring into the store. So, this resource, this is what pharmacy should be. This is what healthcare should be. You shouldn't just be a number. Your voice should be heard, and we all should be heard. She knows what I bring to the table. She knows who I am. She knows my family. She knows your families. So, I think it's great that she supports us, and we just all want to support her in the same way.
Thank you. Thank you, Stephanie, and we understand, and we're just so glad you came over from the dark side to the light side. Thank you for that. And then Jen, who's here in the front, and thank you, Jen.
Hi, my name's Jennifer Bailey, and I'm here with my mom, Donnie Ukolix, and she is fortunate enough to be able to use Martella's pharmacy still. We were afraid she was going to lose with Express Scripts, but she has a Blue Cross plan that does not participate with Express Scripts. So she has Medipacks, and that has been a blessing for our family because we used to have problems with what's this pill for? How many times a day do I take it? And now she has her box right next to her chair and she pulls it out and takes her meds, and I don't have to worry about it. On the other side, my insurance has Express Scripts and my family has had to adjust to going other places for name brand meds, and dealing with Express Scripts has been a nightmare. You dial the 800 number and you can't get a live person on the phone, and if you do, it's just a patient advocate who doesn't know anything about medication or what you're calling about. And if you get a pharmacist on the phone, they tell you to Google and look up what medicine you're asking about. So I truly would love to see Martella's get through this. And for the community, my kids grew up knowing Martella's sponsored just about everything that you ask them to sponsor. My daughter's picture is up in the Parkville store with a trophy for her basketball team when she was in 6th grade, and she graduated this year. And we have always known Martella's to be there for us. So that's my story, and we're there for you guys.
Thank you. So we're in the last about 15-20 minutes of the town hall. Let me tell you a little bit about the next part. So the first thing I'd like to do is open up the conversation for questions or your thoughts or comments or your stories. And we'll do that for about 10-15 minutes.